Is there anything else we can do besides sheltering at home? Well, yes, there is. All of us could wear a mask when we're out in public. Let me emphasize, and this has to be emphasized, the healthcare providers on the front line must have the highest priority for personal protective equipment. That said, there's a reason why in China and South Korea, everyone wears a mask when they're out in public. And at least one major study showed that that cut the rate of transmission by 50%. Combining the wearing a mask plus the other things that have been done probably accounts for the better outcomes in those countries than in other countries. Now keep in mind that masks serve two purposes depending on who's wearing them. They can reduce the risk of getting the virus from someone who's infected. They also reduce the risk of transmitting the virus from an infected person to an uninfected person. What that means is that if everybody is wearing a mask, regardless of who had the virus, the chain of transmission would be reduced. If COVID-19 gave us a clear signal early on of who's infected, we would need to take this approach. If we could text everyone to see if they had COVID-19, we would need to take this approach. Since neither is the case, it's probably time to add another major effort to controlling the virus, and that probably is that when you go out, and only if you go out, have to go out, that you wear a mask. There's a national urgency, and I'm going to repeat this, that the PPE must be reserved for healthcare providers and those on the front line. So many people have resorted to making homemade masks out of bandanas and other kinds of materials. There are a couple of things you really need to know if you're doing this. If the mask has served its purpose, there is every possibility it's contaminated on the outer surface. What that means is that you should do two things. Wash your hands when you take it off, and sterilize it or sanitize it if you're going to use it repeatedly. If possible, wash it in soap and water, and if it's made out of cloth or has no metal staples in it, you can do what I do. Stick it in a plastic bag and microwave it for 2 or 3 minutes at the high setting. Numerous studies show that many types of bacteria, fungus, and viruses are killed by microwave radiation. You must make sure that your improvised device is compatible with microwaving, and if it is, stick it in a plastic bag and zap it for 2 or 3 minutes at the high setting. I want to emphasize, as you heard earlier, that our best strategy still for controlling the virus is to stay at home. My heart breaks every time I hear a news story about a nursing home where the people have gotten infected. The virus is not floating in the air. Someone delivered the virus to that facility. That's how it started. Someone was a vector. Please stay at home. Comply with the order to stay at home. Only go out when you absolutely have to. And if you have to go out, please cover your face to avoid becoming a vector.